but in so many ways I couldn't have predicted where we are today.
Right now is an exciting time for research anywhere.
I think we need to continue to redefine who's on that team.
And ask, what's your bold aspirational goal?
You hear how much they love this place.
The way you succeed at Duke is looking across Duke. David, it's so exciting to be working with you again. We have an interesting history together, don't we?
We do. It goes back almost 20 years.
Right. When I came back in 2010, I asked you to be my first vice chair for clinical. And I don't know if you'd agree, but the biggest challenge that first year or two was the rollout of Epic, which told me you do not shy away from big challenges. But I'd love you to reflect a little bit on how that experience at Duke in the past is informing how you're approaching your current leadership role.
You know, those first almost 10 years at Duke were so foundational, but in so many ways I couldn't have predicted where we are today. In many ways, right, the beginning was just the amazing clinical training and mentorship and experiences that I had. And I envisioned, right, that would be the primary focus. And I love taking care of lung transplant patients. And then the research and the science, which I was so passionate about, and the opportunities to work with just great scientists in the school that taught me how to think and write and problem solve. And you really gave me that first chance at leadership outside of, right, those clinical areas, and which I really hadn't thought of before. So those experiences, and then you really opened the door to a career path in leadership that has been just outstanding.
And you've taken and rolled with it in an extraordinary way. But what you described early on was understanding the essence of Duke, the intersection between research, education, and clinical care. So if you think of your role now, how are you thinking of weaving that all together as you lead the health system?
I think it's the biggest differentiator and the biggest way that Duke Health's going to create value in the future, right? This is such an amazing time when we look at the pace of scientific discovery,
Right.
the innovation, and our unique ability to really bring those together, to say that, right, these aren't in competition, they're actually synergistic. We're going to be taking that research, discovering, right, the new cures, discovering the therapies, and really being ahead of the others, right? Being the first to implement. And as we've talked a lot, really embedding that access to research is patient-centered. The access to that innovation and discovery, right, is a standard of quality. I reflect on my own journey, right, being a patient and involved in clinical research, and how patient-centered it was, because I wanted to ensure that I was doing everything I could to beat my cancer. And that's what I think we frame that for patients, that what I'm getting at Duke Health is as good or better than anywhere else I can get in the world because of that connection to the research that we do each and every day. Where do you see Duke going in the future? What is exciting about the future for Duke research?
Well, right now is an exciting time for research anywhere because of technology and the pace of data science and how much that's evolved. But the model has changed quite a bit. So it's really moved from a model of single investigators that are, curious, to teams of scientists taking on some of the biggest challenges. And I think that's where Duke could really make some headway. Example, in our discovery science, we have started to combine what we call bench scientists with data scientists so that they can work as a team. So definitely a team-based approach. New disciplines for sure. Again, AI, a big discipline that now is really critical to our success in science. And the other aspect of our research environment is our sponsored research is changing. So we have had to think about how do we support research in a different model, looking for other streams of revenue. Philanthropy is a big one. And as you know, we're in the middle of we're made for this campaign.
A record-breaking year.
Yep. It's been successful, but we can't take our focus off of that, particularly as we think about some of the areas that we want to pursue. But also looking at commercial opportunities. And this is another great partnership with the health system where we can work together to ask some critical questions with industry. We are a trusted partner for industry, and now we're really seeing opportunities again on understanding how you use some of the tools like AI in a way that you advance healthcare, but that it's safe and it's trustworthy. And so that concept of being able to do research, but do it in an environment where we're asking the right questions, we're setting up guardrails so that we understand some of the limitations. That's where we want to really distinguish ourselves.
And I think that collaboration between the school and the health system is right what excites some of the industry partners that are looking at Duke Health. And I think it also energizes so many of the donors as we think around what's next in the Mate for this campaign. And that shared understanding around the importance of philanthropy to really help us take Duke Health from the school and the health system to achieve these bold goals. What's next for philanthropy and the Made for This campaign as we start our next year?
Well, we have defined a few areas of research where if we put those teams together, and we have put them together, and ask, what's your bold aspirational goal? We're starting to see narratives that we really want to get in front of donors. One is the concept of healthy aging. Healthy aging is not just about a lot of commercials. It's really about understanding the science of aging, the understanding the science of metabolism. Another big area is the intersection between neuroscience, neurology, neurosurgery, and engineering, putting all that together with the real idea that now we can fine map the brain in ways that we never could before. That provides opportunities for intervention. Interventions are largely driven by engineering. So putting that all together and getting that in front of our donors, really trying to show our donors that we do something different here, that we're approaching some really tough challenges, but we have something unique to add.
And it really goes back, right? It's the people and the teams
Yeah.
that really differentiate what's Duke Health.
So you use the word teams.
Yep.
If I think of science today, it is really teamwork. But it's not just teamwork among the scientists in the lab, it's teamwork between scientists in the lab, scientists in the clinic that can really translate what we do. And how are you thinking about building that connection?
Yeah. In some ways, that really describes healthcare in general, right? It's the ultimate team sport.
Mhm.
And I say that to all of our clinical teams. And it's even going to change, right? The skills that we teach amongst our med students and our residents around being part of teams. I think we need to continue to redefine who's on that team and to ensure that our biggest strength is bringing those clinical leaders, the physicians, the nurses, the patient, and the family, and those research teams together as one. And that's where the power comes from. In some ways, I feel like our job sometimes is being the convener of right bringing those right individuals together that have the amazing talent, the passion, and then giving them the freedom to right achieve the great things that we can do. So I think together, right, we share this vision around breaking down those silos between the clinical and the academic, and that can be Duke's superpower, right? That can be what really differentiates us.
I love it because it is really about our people.
Yep.
And when anybody asks me what I think is so different at Duke, I think it's our people. And it's up to us to create the opportunities to really bring those people together and solve some of the most complex problems.
And I think you see it in our people when you talk to them, right? You hear how much they love being part of that team. You hear how much they love this place, and how much they recognize it. And I think that's what creates the culture that you feel when you walk the halls, whether it's in our research buildings, in our clinical buildings, and it extends into the community, right? Right. We're living in Durham and getting the feel when you walk out in the community of how connected Duke and Durham are together.
Yeah, absolutely. So, David, you mentioned our people, which we really do believe that's the key to our success. And it's across our staff, our faculty, our students. How do you approach kind of bringing everybody along when we're thinking about things like AI? How do you approach training and education so that everybody feels like they're part of that excitement?
So when we talk about being an academic center, right, we aren't just creating education for our students and our residents. It really is that lifelong learning journey.
Mhm.
And I think part of what creates the engagement and the commitment and the retention for being part of Duke Health is the commitment to our people means we all want to continually grow. Creating those growth opportunities is absolutely essential because what we think around, I mean, we think of all the physicians we get to jointly recruit together, right? We're thinking around how do we recruit them and how do we retain them? Is I want to spend the rest of my career at Duke. So I think starting with that commitment, and then we're so fortunate, right, of the number of opportunities that we have for our teammates, and it's not just our physicians, right? It goes to our nurses, it goes to our administrators, it goes to all of our care team members. How we create those career ladders and those paths for people to grow, and we encourage it because that makes them better, which makes Duke better.
Absolutely. I mean, my biggest challenge is how do we make sure everybody knows what those opportunities are?
That is, and I think especially when we think outside of our physicians and get across our to our other care team members, but I think the ability from team members to go from the School of Medicine to the health system, right? It's not even just within their current entity today. It's the ability that we're all one family, and that's what creates some of the opportunities. And I love when we get leaders and team members that have had experiences in different part of the university and school and the health system because I think they bring so much from those different perspectives.
Yeah, no, I agree. I often tell people that are new to our faculty or our environment, the way you succeed at Duke is looking across Duke and looking at all those opportunities. I would challenge us as leaders to do the same thing.
It's great to get a chance to speak with you again, and I am so honored and privileged to get the chance to come back. The first 2 months have just been amazing, and it's exciting to get to partner with you in this journey for right what the great things that are going to be ahead for Duke Health. I think it's just an amazing time, and I couldn't be happier to be back.
And I couldn't be happier that you are back.